Hey, have you heard about community health nursing? Today I came with the most requested video, that is important questions in community health nursing. I can sure that if you are working on all the questions, you can score better. So don't skip the video, and if you are new to the channel, please don't forget to subscribe and press the bell icon so you will not miss any single video. This is Agila. Welcome to Nursing Guru. Community health nursing question paper, which is including the other subjects like nutrition, environmental hygiene and health education. Community health nursing means the course is designed to help students gain an understanding of the concept of community in order to introduce them to the wider horizons of rendering nursing services in a community setup, both in urban and rural areas. Now we will move to the question paper patterns. As same like other question paper, it is also having the pattern of meaning the following true or false, fill in the blanks, short answer and long answers or essay type. Now we will move to the meaning the following questions. First one is mortality, the state of being subject to death. The second question, it is morbidity, refers to have a disease or symptoms of disease or to the amount of disease within a population. Next one is community. Community, a group of people living in the same place or having a particular characteristics in common. Fourth question, health. It is a state of being free from illness or injury. The fifth question is eligible couple. Those married couples in which wife age is between 15 to 45 years. And the sixth question is antenatal care, systematic supervision of a woman during pregnancy. And these are some of the other examples of meaning the following questions like immunity, diuretics, home visiting, isolation, pandemic, family folder, air pollution, cold chain. Now we will move to the next pattern of question, that is fill in the blanks. On that first question is iodine deficiency causes, answer goiter. Next, leprosy is caused by dash, Mycobacterium leprae. Third question, first referral unit of primary health center is dash, answer community health center. Next question, the scientific study of human population is dash, demography. Another one is under 5 clinic is also called as dash, growth and development clinic. The next question is the International Nurses Day is celebrated on dash, answer 12th May. Another question, permanent method of family planning for female is dash, answer tubectomy. Another question is most heat sensitive vaccine is dash, answer OPV. Next question is a disease that is transmitted through contact is dash, answer infectious disease. Next, the infection originating in the patient while in the hospital is called dash, answer nosocomial. Another question, dosage of BCG vaccine is dash, answer 0.05 ml. The last question is World Population Day is celebrated on dash, answer 11th July. Now we will move to the next pattern of question, that is true or false. On that first question, World Health Day is celebrated on April 7th, answer true. Second question, calcium is essential for the formation of muscles, answer true. Third question, a national-wide family planning programmer was launched by Facili in 1997, answer false. Next question, dengue fever is due to the bite of Aedes aegypti mosquito, answer true. Another question, vitamin A is found in sea fish, answer false. Next question, an example of vector-borne transmission disease is malaria, answer true. Next question, community health center has 10 beds. Answer false. Another question is live vaccines are prepared from dead organisms. Answer true. Disease is the maladjustment of human being to the environment. Answer true. Next question is carriers of communicable diseases are not dangerous to the community. Answer false. Another question, action taken before the onset of disease in a community is known as primary prevention. Answer false. And the next question, oral contraceptives are used as temporary method of family planning. Answer true. So these are the true or false type questions. Now we will move to the short answer questions. Short notes or short answer questions, you will get a questions like back technique, levels of health care, uses of epidemiology, characteristics of healthy individual, levels of prevention of disease, uses of epidemiology, community health team, importance of community health nursing process, and family health records, home visiting, under 5 clinic, responsibility of a school health nurse, national immunization schedule, importance of environmental health, types of communication. Next, vitamin C sources, daily requirements and deficiency diseases of vitamin C. Next question, protein energy malnutrition, food adulteration, audio-visual aids, methods of communication, prevention of malnutrition, sources and effects of vitamin A deficiencies, midday meal program, purification of water at domestic level, disinfection of well, health team and its characteristics, referral system. Now we were moving to the next pattern of question, that is long essays or long answers. On that first question, A. Define maternal and child health services. B. Explain the responsibility of a nurse in implementing MCH services. Second question, A. Define community health nursing. B. Explain the scope of community health nursing. C. Discuss the role of a nurse in community health nursing services. Next, A. Define health. B. Explain briefly the determinants of health. Next question, A. Define ventilation. B. Explain the types and standards of ventilation. Another question, A. Define health education. B. Explain the principles of health education. Next question, A. Write the meaning of refuse disposal. B. Explain briefly the difference method of refuse disposal. Another question, A. What are AV-AIDS? B. List the advantages of AV-AIDS. Next question, A. What is infection? B. Write the role of community health nurse in control of infection diseases. Next, list the elements of primary health care. Next question, what advice will you give to the postnatal mother during your home visit? Next question, A. Define community health nursing process. B. Explain the importance and steps of community health nursing process. Next, A question, list the sources of air pollution. B. Explain the prevention and control of air pollution. A. What are the direct and indirect method of disease transmission? B. Write the prevention and control of Anopheles mosquitoes which causes malaria. So these are the repeatedly asked important questions. Don't forget to work on it. I wish all the best for the students who are going to write their upcoming GNM examination. If you have further doubts, you can download the Nursing Guru app. On that, you can chat with the faculties. And don't forget to subscribe our channel. We will meet you on another video.